Hey everyone, my name is Aaron English. I'm the owner, athletic therapist, strength and conditioning coach of Advanced Movement. I thought I would hop on here today to talk about something that has been brought to my attention lately. It's been asked upon me over the last couple of years and specifically this week. Um, the question is, what is the difference between an athletic therapist and a physiotherapist? Don't you guys do the same thing? Um, it depends. We do very similar things within a clinical setting, similar techniques. We use similar machines if we use machines, and we use similar programming of corrective exercises. But we have two different scope of practices that our education was a little different. So I'll go over a couple things that we as athletic therapists do and what physiotherapists do as well. So I'm going to go over maybe the education first of an athletic therapist. Usually it's a 4-year bachelor degree, depending on what school you go to. There's a few schools across Canada that offer this program. I went to York University, so I did undergrad degree and athletic therapy certificate concurrently at the same time. Whereas like at Sheridan College, you're usually doing a 4-year degree. Most of the time with that, you're doing an undergrad before you even get into a program like this, just so you have knowledge of the body, anatomy, physiology, kind of the basis, so you can kind of focus on your athletic therapy stuff for those years. Um, we also have to do clinical and field hours when we're in school. So you're either working with sports teams in a university setting, professional setting, international setting, and doing clinical work within a private setting, school setting, or professional setting. Um, we also, as athletic therapists, focus entirely on the area of assessment and rehabilitation of orthopedic injuries, conditions usually affecting muscles, bones, joints, ligaments, tendons, anything to do with this on our body. Usually we're working with active individuals. It doesn't have to be athletes. We can be helping out a 70-year-old female that just had hip surgery, or we could be working with a 12-year-old kid who's rehabbing from a concussion. We have a wide range of scope of practice within the orthopedic injury range. We also are first responders, so we are always first on site, especially with the like sports coverage. So usually you see athletic therapists on the sidelines of sports events like football, hockey, basketball. So anytime you see someone running out onto the court, ice, field, most likely it's an athletic therapist help in dealing with that emergency situation. And that can be stressful for some people, but it's part of the job. So we deal with the emergency situation, and then we deal with the assessment, then the rehabilitation of that injury, and then we either return them to work, play, or life, get them back even better than what they were before their injury. We also are working. Like I said, we work under these. We work under the sports medicine model, so it's very specific. What we do, as opposed to physiotherapists who have a wide range or like a broad scope of practice, working with orthopedic injuries, cardiorespiratory rehabilitation, burn rehabilitation, pediatric stroke, and neurological rehabilitation. They have a huge range of scope of practice. Depending on when they went to school, they might have a bachelor's degree. That's probably more your older physiotherapist who's been in the practice for 25 plus years, whereas more recent, it has changed in Canada to a master's program. if you go over to the States, you can usually get into a doctorate program over there, but usually in Canada, it's a master's program, or you might see the odd physiotherapist with a bachelor's degree. If they wanted to be on the same first responder level as an athletic therapist, usually have to finish, they have to do their undergrad degree, then their master's degree, and then do extracurricular education to get to the point where they're working with a sports team as a first responder and specializing in that area. And usually you see physiotherapists in hospitals, whereas athletic therapists, you really don't see them in Canada. More so in the States, our counterparts, which are athletic trainers. So do we do the same stuff in the clinic? Very similar. Personally, I see a lot of athletic therapists being manual therapists and movement specialists. Physiotherapists, you see they're trained a lot more on the on electric modalities. You see very traditional physio places where, don't get me wrong, there's awesome movement and manual physiotherapists that work out there and are awesome. So don't get me wrong, they're awesome. And I think either one is great. But if you're looking more towards an active injury or an active person, then go see an athletic therapist. If you have any of the other broad scope, like neurological, cardiorespiratory, stroke stuff, pediatric stuff like that, rehabilitation, more broad scope, I think you should go to a physiotherapist. It's up to you. I hope this video was educational. And if you have any other questions on this subject or anything else to do with strengthening, rehabilitation, prevention, healing, send me a DM or comment in the comments below. Like it.